Is high post-void residual volume serious? Imagine finishing your bathroom visit and still feeling like you haven't fully emptied your bladder. That feeling might be more than just inconvenience. High post-void residual volume means a significant amount of urine remains in your bladder after you urinate. This is not just a small leftover. It can be a sign of underlying issues that need attention. Normally, after urination, only a tiny amount of urine stays in the bladder, less than 100 milliliters. If the residual is between 100 and 200 milliliters, it's considered borderline or uncertain. When it exceeds 200 milliliters, it suggests your bladder isn't emptying properly. If it stays above 300 milliliters over time, it's often called urinary retention, which can be a serious concern. High post-void residual volume can happen for several reasons. It might be caused by blockages like an enlarged prostate or bladder outlet obstruction. Neurological conditions such as multiple sclerosis or spinal cord injuries can interfere with nerve signals that tell the bladder to contract. Previous surgeries or pelvic organ prolapse can also affect bladder emptying. Older adults and women with certain health factors are more at risk. Why is high residual volume serious? First, it increases the risk of urinary tract infections. When urine remains in the bladder, bacteria have a perfect environment to grow, leading to infections that can cause inflammation and damage. Over time, chronic retention can weaken the bladder muscles, making it harder for the bladder to contract properly. This can lead to bladder decompensation, where the bladder becomes less effective at emptying. High residual urine can also put pressure on the kidneys. If urine backs up into the kidneys, it can cause swelling called hydronephrosis and even damage the kidneys over time. This back pressure can lead to serious kidney problems if not treated. People with high residual volume often experience symptoms like a weak or hesitant urine stream, a frequent urge to urinate, feelings of incomplete emptying, or discomfort in the lower abdomen. These symptoms can affect daily life and overall well-being. There is also some concern about the potential link between chronic bladder irritation from retained urine and bladder cancer. While the evidence is not definitive, ongoing inflammation and infections might contribute to changes in the bladder lining. That's why regular monitoring and proper management are important, especially for those with persistent high residual volumes. Doctors diagnose high post-void residual volume mainly through bladder ultrasound or by inserting a catheter after urination to measure how much urine remains. These tests are quick and non-invasive, providing accurate information about bladder emptying. Treatment depends on what's causing the problem. It might involve addressing blockages, managing neurological conditions, or using intermittent catheterization to help empty the bladder safely. Medications can sometimes improve bladder contractions or reduce obstructions. In some cases, surgery might be necessary. Because high post-void residual volume can lead to serious health issues, it's essential to seek medical advice if you experience symptoms or have risk factors. Proper evaluation and treatment can help prevent complications like infections, kidney damage, or bladder dysfunction. Regular checkups and monitoring are key to maintaining bladder health and reducing any potential risks. Remember, each person's situation is unique, so working with healthcare professionals ensures the best care tailored to your needs. If you notice symptoms or have concerns, don't hesitate to get evaluated. Your bladder health is important, and early intervention can make a big difference.